All right, everyone. It's 5 after when the meeting should be started, so we'll begin. Hey, Stacy, can you turn on the subtitles? Oh, they're already on. All right. Well, welcome everybody. This is the April 2022 Barrier Busters meeting. Stacy and myself are coordinating today as Amber is taking a professional development day. So welcome one and all. Today we've got 3 speakers presenting. And then, so let's start off with, is Maria Militzer currently here to talk about the Spanish Interpreter Community Project? I'm not seeing Maria in the participant list yet. Would food gatherers be able to start the presentations then? Is Erin Freeman here?
Hi, yeah, I am. Oh,
great.
There we go. Will I be able to share my screen?
You should be able to share your screen, yeah.
Let's see here. Let me move this. Hi, everybody. So my name is Erin, and I am a community food programs coordinator with Food Gatherers. I've been with the organization for about 8 years now. And I am going to start us off with a video just for ease of sharing. And then I have a PowerPoint that I'll go through as well, and then we'll have time for questions either throughout in the chat or afterwards as well. So let's see. Hopefully this will work for everybody in terms of audio and sharing. Can you all see the celebrating 30 years? Awesome.
Hey, Erin, is there audio attached to this video?
Yeah, is it not?
No, I don't think we're getting audio.
Okay. Let's see. I can try switching. Is that working? No. Those are about the only things I know in terms of fixing that. Nothing. Y'all hear anything? Okay. Well,
put it in the chat, but you'll probably need to stop sharing your screen and then reshare. And there's a little button usually in the bottom left-hand corner that says share audio. And if you click that, that should help you.
Oh, there we go. Thanks.
Mm-hmm.
Just before Thanksgiving in 1988, Paul Saginaw and a handful of Zingerman staff borrowed a van. They loaded up the van with surplus food from restaurants and grocery stores and quickly distributed it to St. Andrews in Ann Arbor and Brown Chapel in Ypsilanti. This simple act of connecting those who have more than enough food to those who have too little food would grow into Michigan's first food rescue program. Zingerman's nurtured food gatherers and gave us our own set of wheels, continuous support, and a healthy dose of chutzpah. Food Gatherers soon became an independent nonprofit and embarked on a journey to engage every food business, every public institution, and every single one of our community members in fighting hunger where we live.
Food Gatherers started as a program to supplement existing federal programs. As the federal safety net dwindled, Food Gatherers very strategically and very agilely adapted to meet the need in the community. The 2009 Great Recession created huge numbers of people who were food insecure. It was at that point that Food Gatherers really grew and adapted, again, to create this safety net system.
When Food Gatherers became the real food bank of this community, that allowed us to be able to decrease the amount of money that we would spend at regular grocery stores and to be able to save money, which then would allow us to serve more people. It's taking that pressure off our back that we have one central source that we can come to, and it helps to supplement, in the case of Peace Neighborhood Center, about 50% of our annual food costs. That explosion, that great explosion of being a food bank and food rescue all combined was extraordinary for us and for this community.
For many years, Food Gatherers measured our success by the pounds of food we distributed. We learned from the people we were serving and began to connect the dots between hunger and health. Not just more pounds, but more nutritious and more economically valuable food was needed. We began to invest in our capacity and the capacity of our partner agencies to distribute more vegetables, more fruit, and more protein.
Food Gatherers supplies Hope with a lot of different kinds of food for our different programs. Their truck comes 3 to 4 times a week. Almost every day that we're open, they're here delivering for a different program. We look forward to seeing the truck come. It's big and it's orange, and the people come out and they have big smiles, and they're just super friendly, they're efficient, they're helpful. We did something with them that was called the Food Pantry Conversion Project, and we made it so there were more healthy items available or more prominently displayed, and they helped us purchase a large refrigeration cooler for more dairy products and more low-fat.
We didn't have Food Gatherers. We have to limit the amount of times that people can come to our food pantry each month. We would have to limit the amount of food that we're allowed to hand out, and it would probably only be able to be a lot of processed foods, which are high in sodium and can have negative impacts on people's health. We get 95% of our food from Food Gatherers.
When we look at the statistics, I believe close to 15% of the residents have food insecurity at some point in their life. That number is even heightened when you look at young moms. And at Corner Health Center, over 50% of our patients and our clients are young moms or expecting moms. The work that Food Gatherers does, not only with Corner Health Center, but with other agencies, allows those who otherwise wouldn't have access to fresh produce and food. It actually gives them that opportunity to come to our pantry or visit another pantry.
Food Gatherers has been above and beyond ever since I've started working with them. And I can count on one hand the amount of times that a delivery ever showed up late. And quite frankly, I have not seen a single other partner in which that is the case. At one of our locations, we were doing about 90,000 pounds of food at the very beginning, and is now doing regularly over 450,000 pounds of food. Really a big part of that shift was an increase in the amount of produce that we were getting as an agency. And so then ultimately the clients that we were serving were getting much healthier products as a result. The most common feedback they were getting was the reduction in health issues from the families that we were working with. Several of which were even noting that they were virtually on the verge of death because they could not afford having the proper nutrition to support breaking free of the challenges with like diabetes and heart disease and a variety of other health factors.
In Washtenaw County, the cost of living is so high that someone earning minimum wage would have to work 3 jobs to make ends meet. Yet they make too much money to qualify for many government assistance programs. 40% of our neighbors struggling with food insecurity are not even eligible for SNAP. 40%.
Food's not enough if you want to solve hunger. You've got to create food security. So looking at Maslow's hierarchy of need, physiological, air, water, food. If you're hungry, you only have one problem. Second step in Maslow's hierarchy of need is safety, and you shouldn't feel more safe than you do in your own home. But until people have food, their mind's not free to think about those higher needs. So food gatherers coming in to create food security, the right size safety net for people, allows them the opportunity to begin to solve problems on their own.
Whenever possible, we use food as a tool to address root causes. We partner with Ozone House to provide culinary training and life skills to youth at risk of homelessness. We partnered with Avalon Housing to create permanently affordable housing right next to our warehouse, a visible testament to the connection between hunger and homelessness. Food Gatherers strategically fills the gaps in the safety net system by creating our own direct service programs or leveraging existing federal programs.
In the county overall, the proportion of children that are food insecure who do not have enough food on a regular basis is 12%. In Ypsilanti in particular, it rises to between 40 and 50%. And over half of those kids are not eligible for any federal nutrition programs. One of the best things about the summer food service program is that we can give kids exposure to foods their parents wouldn't afford to be able to try otherwise. Trying new stuff is expensive and risky if your kids don't like it, but when they have an opportunity to try a wide variety of fruits and vegetables with no financial risk involved, they find a ton of things that they really like. One of my favorite stories was a kid who had never had green beans before, who tried one at summer food and now said his parents buy them every week. It's his new favorite thing.
The Delanis Center is a county building, and Food Gatherers runs the kitchen, and the other tenant in the building is the Shelter Association of Washtenaw County, and we house homeless men and women here. Every day, I wait for the Food Gatherers truck to show up at 1 o'clock, that I see what we have to work with for today and for tomorrow, and then I create our menu. I know what my protein is, I see what carbohydrates and vegetables I have, what I can use to make salads, and then I have to look at the volunteer list. I have to assess skill level, and then we just get into it, and it's complete improvisation. And so we meld it together as a team, and at 5 o'clock when we're done cooking, it's just amazing. We always face a challenge here every day. We have to have the highest standards, both in terms of the quality of food we serve, but more importantly, that we serve it safely and that we keep this kitchen in tip-top shape. We train constantly as a team, and we train our volunteers. So every day is a different volunteer shift. So we are training 3 and 4 and 5 times a day. The volunteer force is very, very talented, and we do some incredible meals here that make people feel welcome and appreciated and nourished.
Powered by a network of more than 7,000 volunteers and funded almost entirely by private donations, Food Gatherers procures food from more than 1,000 sources and delivers the equivalent of 14,500 meals a day to 170 programs in 18 townships and all 6 cities of Washtenaw County. More than 90% of every donation goes directly to programs, earning us a spot in the top 1% of charities rated by Charity Navigator.
Every activity, every program, every idea, every innovation that food banks are doing nationwide is happening in this building. Food Gatherers is one of the first food banks in the nation to begin to pilot and work with healthcare. And to do that, you have to be specialized. You can't really just depend on donated food in order to meet the outcomes that healthcare is looking for. And so that means you have to be really good at purchasing food and make sure your donor dollars go well. What you'll find here at Food Gatherers is they've been first and they've been innovative in all of these approaches. When you relieve that burden of food insecurity to them, then it's just not a pilot that got funded, it's a program that needs to be sustained because it's having impact in people's lives.
Food Gatherers is a well-oiled machine, but it needs to oil to make sure it works properly. It needs a constant influx of volunteers and money to be able to do what it does. It needs a constant influx of people who see this as an issue in our community and understand that what is happening with Food Gatherers' mission is assisting a great population of people in this county. People who are your next door neighbors, who you might not be aware of, who are food insecure, who are suffering from deciding I have to pay rent or I have to pay these medical costs. And the first thing that gets cut is food. That safety net is a safety net that's provided by Food Gatherers. And we need to continue to help support an organization like Food Gatherers that's a part of this great safety net for this community and many of the people in this community who are our neighbors.
All right. Thank you all for watching that. I'm going to share my PowerPoint. And I want to point out there's so many partners on this call that were in the video, which is really cool. We could not do this work without you. Think I would. Can you guys all see this slide? Awesome, thanks. So as you heard in the video, we're the food bank and food rescue program that serves Washtenaw County. Here are some things that I was asked to discuss today. So the overview of Food Gatherers, which the video covers, and then some resources that we're able to provide, our new partnership with Doordash, and our new outreach partnership. And then I have some contact information as well as like a fun video that our team put together back on Valentine's Day, but it just gives a little bit of an overview of recent statistics. And then time for questions. So we have a few different steps in terms of addressing alleviating hunger and eliminating its root causes. So step one, alleviating hunger, is getting somebody food. So our team handles what we call find food calls. And so anyone calling our food bank, we're able to assist them and direct them to a pantry, direct them to getting government assistance such as SNAP, and really plugging them in. Step two, improving access to better to food, better hours, healthier choices, culturally appropriate foods. Third step is maximizing available resources, like I mentioned with SNAP, WIC, double up food bucks, etc. And then connecting to other support, so stable housing, adequate employment, healthcare. So when somebody's calling us needing food, there's often other things that would be helpful for them to get access to and know about that's going on in our county. Here are just some food insecurity statistics. In the United States, it's 1 in 8 Americans live in food insecure households. And in Washtenaw County, it's 1 in 7. That's 49,000 food insecure individuals, including 9,000 children. And as you heard in the video, 40% are not eligible for public benefits, such as SNAP in Washtenaw County. However, they're still struggling to make ends meet because of the really expensive housing cost of living to make ends meet. So here is our flyer. It is available in many different languages, and we have this all throughout our website. And I can make sure to send the links that will go out in the notes as well. But basically, all of our food pantry network had to really rise to COVID and adapt pretty strategically to be able to continue to get food out to our neighbors. So many had been doing low contact, grab and go, pre-packing stuff and making it readily available for folks to pick up. A few of our sites quickly switched to offering deliveries to clients all over the county. Really impressive work that has been done. Items that are available include fresh produce, dairy, meats, bakery items, and non-perishable things as well. And then the food is available to anyone who needs it. And so making sure we train all of our programs to make sure that they're inclusive and able to provide food to anybody that needs it without having to show any kind of proof of need. So here's some pictures of the food that we typically send out, including a few of them are, or at least one of them is from our community kitchen. They've also had to navigate COVID and switch to to-go meals as well. Some setups at the pantries. So we've got a bunch of different partners pictured here, as well as meal programs. So some folks are still sorting and having a choice style pantry. Others are pre-boxing and sending that out. Many have created lists and, you know, typical food items that you might see in a pantry. And so there is still some choice available there as well. Some intake photos. So as I mentioned before, some folks are able to load up cars. In the third picture there at the bottom, she's got a list of different items that are available in the pantry so they can bring it outside and have the person check off what they might want to take home. And here's some distribution pictures. Some are outside, especially in the height of COVID. We were able to provide tents and folks had tables set up and sorting products, getting it into people's cars or baskets if they're taking the bus. And then here's a slide about our new partnership with Doordash. So the Food Bank Council of Michigan brought this to our attention, and we have been able to partner with Project Dash, which is an arm of Doordash, who is able to provide grocery delivery to clients throughout Washtenaw County. The pantries that we've partnered with on this were already offering grocery delivery, and so it was really able to help them maximize their capacity in terms of their volunteers that were previously offering grocery delivery. So they still utilize their volunteers, but they've been able to make more deliveries with this partnership. And some of those pantries include Hope Clinic, Jewish Family Services, and Beautiful Gate. And so they're still utilizing their regular intake in terms of getting somebody signed up. They would just give the client would give a call, or you could call them to sign them up, and it's just a matter of who would then be delivering to the client. So DoorDash, it's nice because they'll send a text to the person just as it would if you were getting, you know, something from a restaurant, and they'll leave it at the doorstep, and they are still doing no contact at this time. And then on our website, we have how to find a food pantry. So at the end, if anyone would like me to go through how to do this, I'm happy to do that. But it's just at foodgatherers.org/findfood, and you'll find a map of all of the pantries in the area. There's also lists just below that map that then expand. So there's Ann Arbor list and Ypsilanti list outside of those two cities. So in that list, it would include places like Saline and Manchester and Chelsea, Dexter. And then the link just below that is open now. And if you click that, it will show you the pantries that are open at the moment that you're looking at that web page. And then of course, you're welcome to call us at any point if you're looking for something and can't find it, or send clients to talk to us. Like I said, we've got staff that handle those phone calls every day and are trained to help people find food. We have some direct service programs, as the video mentioned. One of them is the Healthy School Pantry program. You can find information about that on our website as well. But we partner with a handful of schools throughout the county to distribute fresh produce as well as non-perishable items. And depending on the school and their capacity, sometimes they might offer dairy or meat as well. The model will look different across schools. Some are doing like what we call a just-in-time distribution, where the food gatherer's truck arrives, a lot of food is dropped off, and then it's pretty much immediately going home with the family. Others have an on-site school pantry. So Ypsilanti High School, for example, and Holmes Elementary have an on-site pantry that's available to students and their families when the school is open. And then our summer food service program. This meeting is great timing as we're starting to plan for this. My coworker, Laronica, is the manager of our summer food service program. Last year we had 20 sites that were on board. And what this program is just to help fill in the gaps during the summer when the kids don't have access to that free or reduced priced meal at their school. There are a lot of, at this time, we are still figuring out whether or not it will be allowed to be a grab and go like summers past because of COVID. And we'll be updating everybody with information about that as we hear from the state. But it will be happening either way. So if kids will either have to eat on site or they'll be able to take meals home. And then we'll have a list of those specific sites and addresses on our website, foodgatherers.org/summerfood. So you can check back there for any updates, or feel free to call us and we're happy to point you in the right direction. If you're interested in being a summer food site, you can also reach out to us. There's a summer food email that's listed there, summerfood@foodgatherers.org, to inquire. And then we also connect to government resources. So when we're getting phone calls for folks who might need food, we definitely want to handle that emergent situation, get them hooked up with a food pantry, but then also make sure that they're applying for benefits if they might be eligible. So we are a navigation partner, and we can help people apply for the Supplemental Nutrition Assistance Program, as well as these other programs that are listed here on the website, on the PowerPoint. And then for anyone that doesn't know, there is a helpline that's available. If you have people that speak other languages other than English, it's super helpful. They have like over 100 different languages that they can help folks in. And they would help, it's called the Food and Other Resources Helpline, or the FOR helpline, and it's run by the Food Bank Council of Michigan. The number is 1-888-544-8773, and they can help in other languages, and or just advocate for a client if they're having trouble getting access to benefits. I have on here the Double Up Food Program. So just plugging this, some markets are open year round, but a good summer tip is that folks can get double the amount of fresh produce if they use their bridge card at the farmer's market. And then lastly, we have our new outreach partnership model. This is a great program that we just started, and we are bringing on board anyone in the community who's really interested in helping us connect to neighbors who need food. And so we really are relying on trusted relationships that neighbors have with all of you, as well as other organizations in the community. And so a few different ways you can help with this is definitely reach out to us if you want to become an outreach partner. We held our first training, and so we're just training a group to be able to refer folks to food, teaching them about the process and what's available, and providing feedback to food gatherers as well. So we're hearing what's working, what's not, and how we can improve services. on our website, there's a Google form, or you're welcome to just reach out to us. And then even more ways to get involved if you're looking to hear about advocacy alerts, participate in that. You can sign up for our listserv. You could also be a volunteer at Food Gatherers, or a volunteer at any of the local food pantries. We have the list that I went over. You can contact them directly, and I'm sure they'd love your help. And then if you guys have any questions, here is our contact information. Our whole team uses the cfp@foodgatherers.org as our email. It stands for Community Food Programs. So at this time, if anyone has questions, I'm happy to answer. And thanks everyone for your time. See if there were anything in the chat.
Erin, I'm just curious about summer foods. So
Yes.
it starts like, does it follow the school year exactly? There's no overlap, like there's no like summer foods like shortly before classes or in the beginning of the fall?
Yeah, it usually runs from June and through August. I forget what the end date is, but it is that gap in the summer. Did that answer your question? Okay. There are like the school breakfast programs, school snack programs that operate during the school year. We just don't, we're not a sponsor of those. So those are operated directly by the school, like food service.
And there's a question in the chat about, yes, the presentations will be available on the Barrier Busters website afterwards. Then there was also a question about the number
the
for
food line. Yeah, let me put that in the chat.
All right, well, thank you so much, Erin. Really
Yeah,
appreciate
thank you.
you coming today. Next, we've got Ann Arbor Meals on Wheels, Susan Atkins and Haley Bank, who will be providing an overview of their programming.
I will share my screen with the slides. All right, so hi everybody, my name's Haley Bank. I'm the MSW social worker with Ann Arbor Meals on Wheels. And I'm presenting today with my coworker, Susan Atkins, and she's our BSW social worker with Ann Arbor Meals on Wheels. All right. So Ann Arbor Meals on Wheels, we fall under Michigan Medicine, and then we are part of the Community Health Services Department. So since 1974, Ann Arbor Meals on Wheels has worked to reduce hunger and food insecurity for our homebound adult neighbors in the Ann Arbor area who, because of their health, are unable to shop and prepare nutritious meals for themselves. So our staff and volunteers are committed to supporting the dignity and independence of our homebound community members who are largely unable to leave home because of their health status. We value diversity, equity, and inclusion and seek to provide services that are culturally responsive. So who we serve. Our goal is to help meet the nutrition needs of the homebound members of our community and help them age in place as long as safely possible. We serve primarily older adults and individuals with disabilities. Folks must be homebound due to physical or mental health reasons, and individuals are served regardless of age or financial status. A client's spouse or unpaid caregiver may also be eligible to receive meals. So eligibility. Ann Arbor Meals on Wheels clients must live in our service area. We need to safely be able to meet their nutritional needs. So for example, if somebody has certain food allergies, we may not be able to safely provide meals for them. Home delivered meals are for individuals who cannot prepare complete nutritious meals for themselves. And then clients must be home when the meals are delivered and agree to an in-home assessment and then reassessments every 6 months. However, right now, due to COVID, we are conducting all of our assessments and reassessments over the phone. So this map highlights our service area. So our service area is this light green. If you are interested in referring a client and you want to make sure that they're in our service area, you can actually access this map if you go to the Washtenaw County website and you go to the Senior Nutrition Program tab. It'll bring this up and you can put the person's address in, and then it'll tell you which Meals on Wheels program they fall within. And then it'll pull up the contact information. So then here are some pictures of the different meal types we serve. So we offer a hot meal option. So with our hot meal, somebody has a choice between a standard hot or an option 2, which is vegetarian. These are our Western style meals. So it's typically a main entree, as well as a fruit and vegetable on the side, usually some type of starch like a dinner roll, and then sometimes a dessert as well. And then we also provide milk with all of our meals. We also offer a cold bag, which is typically some type of sandwich or salad. And then those meals also come with a fruit and vegetable on the side and milk. And then we also provide Ensure or liquid nutrition supplement. So if somebody needs additional calories or things like that, then we have a prescription that their doctor can sign and approve them to receive liquid nutrition. And then additionally, we have a third hot meal option. So we do offer an Asian meal. All of our Asian meals are prepared by Lucky Kitchen. And so we have our main dish, and then they always receive fresh fruit and yogurt or orange juice on the side. We're able to provide up to 2 meals a day, Monday through Saturday, and 1 meal for Sunday, if somebody needs. And right now we are delivering on a condensed delivery schedule. So we are delivering on Tuesday, Thursday, and Saturday. So if someone needs meals for every day of the week, then we're providing double meals on each delivery day that they can put in the fridge, and then the hot meal would need to be reheated in the microwave.
Okay, so I will talk next about our new client intake process. So this is just a picture of our intake form here. It's pretty short and sweet, 1 page front and back. You can find this on our website, and at the end of the presentation, we'll include our website address as well. So we essentially just need some basic demographic information, emergency contacts, the person's doctor or primary care provider, health conditions as well. And then we ask some questions about how is this person currently getting food? Are they able to grocery shop or prepare nutritious meals? And if not, why? Just listing out some of those challenges and difficulties. And next slide, please. Okay. And then a little bit more information about our intake process. So if you'd rather not fill out that form, you can call our office and either Haley or I can go through the form either with you or with the potential client. Once you complete the form, you can either fax it or mail it to us at Meals on Wheels. We just ask that you not email it right now for security reasons. And then we'll review the intake, and if the person appears to be eligible based on the information and they live within our service area, we'll call them to schedule an initial assessment over the phone. Eventually we'll get back to doing those in person, but again, right now, primarily over the phone, just for safety precautions. And then following the assessment, we'll fax over what's called a homebound status form or an eligibility form to their provider, just to verify that they are homebound and eligible for our program. And then once the form is returned to us, the client will be contacted by one of our client service coordinators to get them routed and started. And I usually tell folks the whole process can take about 2 weeks from the time of the assessment. It just depends how fast the providers, can get the form back to us. Next slide, please. Okay, and then I think Haley did touch on this, so I'll just go through this briefly, but at Meals on Wheels, we remain committed to serving our homebound neighbors in the midst of COVID-19, and we continue to adjust our operations in order to keep our volunteers, clients, and staff as safe and healthy as possible. Yep, so we've consolidated our delivery days into 3 rather than our normal 6, mainly in order to reduce contact between volunteers and clients, but clients are still receiving the same number of meals per week. And that is up to 13 meals, depending on how many they would like. Okay, next slide, please. And then just, this is some impacts or some information about our impact from fiscal year 21. So as you can see, a great number of folks have told us that they now eat healthier because of Meals on Wheels, and that Meals on Wheels has helped them to stay in their home and live independently. And another big piece of this is that the Ann Arbor Meals on Wheels volunteers provide not only meals, but the human connection, which can bring comfort and security to our clients. Okay, next slide. And then we are so grateful for our many volunteers who deliver food to our clients each delivery day. So in fiscal year 21, 228 Meals on Wheels volunteers spent 6,975 hours driving 46,100 miles to carry out wellness checks and to deliver 120,937 meals to 384 clients, kind of a mouthful there. So in all that we do, Ann Arbor Meals on Wheels seeks to be more than a meal. Knowing how important good nutrition and social interaction are to health and well-being, Ann Arbor Meals on Wheels staff and volunteers work together to provide nutritiously balanced meals and carry out safety and wellness checks for all of our clients. And for many of our participants, the volunteer or staff member who delivers their meal may be the only person they see all day. And so those volunteers report back any concerns that they have to us. And typically Haley or I or someone from the front will follow up with those concerns, which may include reaching out to an emergency contact. Okay, next slide. And then as promised, here is our contact information. We were previously located off of Traverwood on Plymouth Road. We moved last summer, the end of July, to State Street. So we're in the KMS building, which is a Michigan Medicine building. You can reach us by phone, email, and then there's our website as well, where you can find that referral form. And then lastly, these are just some really nice comments that we received from some of our folks at the end of fiscal year 21. And I wanted to see if folks had questions or concerns for us. Let's see. Oh, Beth, thank you for your nice comment. We've received many referrals from Meals on Wheels to our homebound library programs and the library for the blind and print disabled. So we also send out a new client welcome folder and always include that information in there with some other resources as well. So I'm really glad to hear that. Excellent. Other questions or concerns? And you can always reach out to me or Haley individually too if you have questions. But yeah, All right, I think that's it. Thank you.
All right. Thanks, Susan, and thanks, Haley. Just checking one more time to see if Maria Militzer is here to talk about the Spanish translation program. She's I don't see her. No one else is representing. Okay. Okay, just double checking. All right. And then next, just to provide a funding update. Again, we are currently broke. During first quarter, we ran out of funds in about 6 weeks. In quarter two, there was quite a bit of pent up demand, and we went through all of our flexible funding in about 2 weeks. So there is an initiative to try to get some more funds in front of us. We've approached some different municipalities. So we're hopeful of that, fingers crossed, but as of right now, the next quarter of funding won't be starting until July 1st. Are there any questions about that?
Yes, I have a question. Sure. Is there a possibility of making the quarterly budget a monthly budget so that it lasts a little bit longer? Just wondering.
That's definitely possible. I mean, we could try that. So you mean like having each month have their allotment as opposed to doing it on a quarterly basis?
Right, because we run out. I mean, I don't know historically how bad that's been, but running out and having nothing for 2 months is a bit harder
Sure.
as someone who's looking for resources than knowing that there's a little smaller amount each month.
Right. Yeah. And I think that come July, we can definitely do a pilot on that and get feedback. I'm just thinking real quick that one possible concern would be just as far as agencies getting their screening and intake together for that limited amount of time. But I guess that's also true if you've got it set up on a quarterly basis and then you're suddenly out of funding too. So no, I like the idea, Rebecca, and let's try to pilot that in July or sooner if we get lucky and get some more funding. And to your question about historically, most years, even pre-pandemic, we had funding each quarter into the last week and a half to 2 weeks. So this year is just, there's a lot of factors that have changed, not the least of which is the COVID emergency rental assistance program is winding down, and there's been a lot of changes where it's requiring more identification. Folks who might not have legal standing in the US no longer can apply. And a big boon for us last year is that you didn't have to be behind on rent, but if you were behind on utilities, you could still apply for CERA. And that's no longer the case, which is why we're seeing about 67% of all requests are coming in for utilities. All right.
Thanks, Moon.
Thanks, Rebecca. All right, then. Okay, so now we're going to do the adjournment of the formal meeting. And as we tried last month, we're going to try to break out into small groups. We're going to, since there's about, well, we'll see how many people stick around, but the meeting's formally over. But if you want to stick around and break out into small groups where we can talk about, do some networking and have a discussion about what does trauma-informed care mean to you. The breakout groups will be around for about 10 minutes, and then we'll come back to the main room and do a report out. So give a minute for anybody who wants to leave, and then we'll be entering into small groups. Thanks, everyone.
Hey Moon, could you tell us again what our breakout topic is going to be?
Oh, yeah.
Can you say that again?
Sure. What does trauma-informed care mean to you?
Thank you.
Okay, looks like it's going to be all of us. Since it's about 12, I'm going to break it into 2 groups of 6. And let's see, add a room. Wait, now it's 11, so it'll be 5 and 6 then. Hang on, 2, 3, 4, 5. Okay. Lynn. I guess they're all in the rooms now. I guess we don't get to be in the rooms. I didn't see an option to add us. You're muted. Stacy, I think you're muted.
Yes, completely forgot I was muted. I have a screen that that says it looks like I can join one. Room 1 or room 2. Do you see
okay.
that?
Yeah, I see that. Which room are you going to join?
I'll join room 2.
Okay, I'll join room 1 then. Hey, everyone. So, just as far as takeaways from group number, I think we were group number 1. If I've missed anything, please let me know. Just around trauma-informed care, there's a real importance just as far as being sensitive around your language, around trying to be very empathic to the people that you're working with. And then, also issues of like how to make sure that you and your team, your staff, also, aren't re-traumatized or get secondary shrapnel, I guess, from it all is really important. Rebecca raised an interesting thing that JFS uses, which is that like for their WISE program, which focuses on seniors in case management. If there's like a relationship in between a client and a staff that it's just simply not working out for whatever reason, that they'll actually try to do a handoff to a different staff member with that client. And sometimes with that new relationship, there might be a different perspective. There might not be some of the knee-jerk kind of like things that have built up in that initial relationship. That allows maybe the client to be, the client's needs to be better met, and then also to keep the staff from burning out too. Anything I miss? Okay.
Just that it's not a common practice. It's something we use very sparingly and only in those cases where we really have, the client is just the relationship is no longer therapeutic. So
Right. Things have become stuck, right? Makes sense. And as you mentioned, Rebecca, because the last thing you want to do is to, one, you want to maintain your staff, but then also you want to make sure that you're not re-traumatizing your clientele. How about for the other group?
Yeah, I can kind of do a little recap. So there was a couple of points that we made. And Megan and Eleanor, please jump in if I've missed something. But there's a couple of points that we talked about that was really an interesting take on. So we had Beth from Ann Arbor District Library. And so what she was speaking of was the various people that come in and the situations that they're in and how the staff, how to handle some of these experiences and being able to respond in a healthy way with these people that might be in a traumatic type of a situation. And so just educating the staff, talking about how just educating the staff and understanding. I think Megan talked about doing the de-escalation. So the library staff would have skills at being able to de-escalate and be able to communicate and respond in a healthy way. Eleanor pointed out that, sometimes when this trauma response, her agency, being in that trauma response is where her agency can come in and help. And so sometimes it takes these trauma experience or response for her agency to come in and step in and do it and to be identified. So sometimes it needs to be escalated to a point. Eleanor, she works with the disabled community and various, am I right, Eleanor? I got that, okay. And so for her response, it would be that, a situation, a trauma response, all those situations already are in existence. And then her agency comes in and works with those in need. How's that? Did I sum it up about it?
Well, cool. Well, thanks everybody for hanging around for the networking and breakout groups. And everyone have a great week. See you next month.
Bye. Thank you, everyone.